Good afternoon. This is June 25th, and I'm Pat Merriweather Argus, past District Governor with District 6450. As of today, about 2.4 million U.S. residents have confirmed COVID-19 cases. About 122,000 people have died of COVID-19, which translate to about 5.1% of those that get COVID-19 have died. We are now in phase 4 of the Illinois 5-phase plan, and that includes many opportunities to open up while still maintaining wearing masks and social distancing. So if you want additional information on phase 4 and the opportunities and the initiatives that are now opened up, please go to our district website at www.rotary6450.org. Now, many services are now open, but in order to maintain that, to maintain us in phase 4, we really need to make sure that we are practicing social distancing and following the guidelines and rules. If we want to go to phase 5, that's a little bit more difficult because it does require a vaccine, contact tracing, and also a continuous downward trend. Now with phase 5, in terms of the vaccine, Chicago is going to be testing the vaccine next month, actually almost next week. They begin the trial, the third phase of a trial for a vaccine for COVID-19. And they will be testing for 1,000 patients will get the COVID-19 vaccine. 40% of those patients will be over the age of 65. And the others will be Blacks or Latinx population because Chicago will be the site where they try and identify the patients that are most vulnerable and could benefit from the vaccine. Now, what's unusual about this is as much as medications and vaccines and everything are historically have been made available to patients that are 65 and over, rarely up until a year ago did the NIH require that patients 65 and over are involved in the studies, the clinical trials and the studies. So again, this is a major breakthrough, and it also means that we'll be able to bring a vaccine that works to the public much sooner than many had anticipated. So it could be available depending upon how the trial goes at the end of this year or early next year, and then it becomes the manufacturing of the vaccine and the dissemination of it. Now for nursing homes, there's a little bit of a challenge there because they must have 28 days of no COVID-19 cases within their facility. They also must have no staffing shortages, no PPE shortages, and they must make sure that they are practicing the daily protocols for residents and staff assessment of symptoms and must be implementing the requirements for infection control and procedures and prevention. And now that's a little bit more difficult because they also do have to submit a report that the federal government has developed. And it's about 32 pages of questions that they have to respond to in a favorable manner in order to be allowed to open up their facilities to visitors. This is now, today is day 105 in which nursing homes have had no visitors, no family members, no friends, no chaplains, no volunteers. That is going to change a little bit in Illinois because they will allow nursing homes that meet those requirements of staffing, testing for COVID-19. They will allow residents to meet outside of their facility with a family member, or loved one, or friend. Now, in order for that to happen, the visitor must contact the nursing home facility to see if they're ready to accept visitors. It'll take some time for them all to get up to meeting the requirements and the protocols and having the staff in place to assist on this, but you must pre-arrange a visit The day of the visit, of course, you must wear a mask and you must keep social distance. You also will be tested for your temperature, as well as filling out a form that you have not been around people with COVID-19, and you also have you don't have any of the symptoms of COVID-19. And you'll be allowed to visit your loved one, keeping a social distance outside. There will be a nursing home staff person with that patient, that resident, all the time, because again, of their special needs or needs that they have. The challenge for many nursing home residents is they have been on strict quarantine. They have remained in their rooms. And so many of them, most of them, have had all of their meals in their room: breakfast, lunch, and dinner, snacks. Everything is within the room. So they are a little bit weak in terms of getting up and moving around. So you may see a loved one that used to be able to, get up out of a chair on their own, and they may need assistance doing that. So again, that's why the nursing home staff are also going to be with them, is to make sure that they're physically able to have that meeting with their loved one. So again, it is great news. Many nursing home residents are really feeling the isolation, feeling some levels of depression because they are so isolated. And this will be a wonderful step forward. But again, keep in mind, we want to keep going forward. We don't want to go backwards. I think we all have heard about Texas today, with Austin, Dallas, Houston, and San Antonio putting in place restrictions that they didn't have in place before, and now they're going sort of backwards. And they're feeling the surge of the hospitalizations as well. They're at near, or some of them are over capacity, and setting up tents and planning on other hospital level types of facilities that can be utilized. So again, keep the social distance. We're all Rotarians. We know that nursing home residents are not getting the infection from each other right now, although it can spread within once somebody gets it. But right now it's coming in from the outside. Staff that may not have any symptoms may be bringing the virus in, and that's how it's spreading. So again, it's community acquired COVID-19. And if we can all practice wearing the mask and keeping the social distance and following the protocols that are in place by the locations that we're visiting, I think we'll be able to stay at stage 4, phase 4, and look forward to the time when we are in phase 5. Thank you all, and we'll talk soon. Take care and stay healthy.